Well, for the past 2 months, we've watched our state's healthcare systems rise to the occasion of COVID-19 and provide care to some very ill and contagious patients. Joining us now to talk more about that is Jeffrey Flaks, President and CEO of Hartford HealthCare. Thank you for joining us.
Oh, my pleasure. Thank you, Lisa.
Thank you. So we're 8 weeks in. It's so hard to believe. What is it like to lead a health organization through a crisis that has never been seen before? Tell us about what you've been through and the lessons you've learned.
Well, it's been unimaginable. I think the first lesson we've learned is not something was surprising to me. The unbelievable resilience of all people working in healthcare, particularly those on the front lines. Their work has been incredibly inspiring, and their resilience is nothing short of remarkable. But we've learned a tremendous amount, Lisa. We've learned a lot about how to put better procedures in place around infection control, how to create safer environments around testing our staff members as they enter our buildings, ways to test all patients before they have different procedures. We've put new procedures within our institutions around how we're cleaning different rooms and different environments. So the learnings are massive and numerous, and many are going to carry forward and become standard work and part of our process going forward.
Wow, it's been quite a few weeks. All right, so now with the state partially open and we begin to move into phase 2 of the state reopening, how are hospitals recovering?
Well, it's been difficult. Look, we had major distress for our institutions. We had to go out and change the way we work. We had to disrupt all of our operations at so many different levels. We had to acquire mass amounts of personal protective equipment in this process, and we had to stand down so many of our services. So truthfully, the financial impact on our institutions has been massive and very negative. But I've said from the very beginning that's not going to guide or affect any of our decision making. This is our purpose. It's why we're here, and we're going to do what's ever necessary for our communities in this crisis. So as we now are emerging from the crisis, we're continuing to care for COVID-positive patients, and at the same time, we're caring for more patients as we start to reintroduce our core services. And lastly, we're not standing down our readiness in any way with the risk of a second wave going forward or even a different spike that may occur at any point in time.
Okay, let's talk about the return to surgery now. Is that back to a normal volume yet?
So we're not yet at a normal volume, but it's increasing significantly every day and each week, which I'm really pleased. I often describe the health system as really the safest place to be within the community. There's no place that has more protections and more precautions put in place. So I'm very pleased that people are getting the services they need that are essential, that are emergent, that are urgent, helping people get out of pain and discomfort, and providing what we do and why we're here, healthcare services to all.
Okay, hospital safety has been on the forefront, of course, as you talked. Many fear coming to the hospital will expose them to COVID. Tell us about the system protocol and measures that have been put into place.
Yeah, so first, before anyone enters our building, they get screened both through a series of questions, through a thermometer, temperature checking process, going past clinicians to enter any one of our buildings. We still maintain a series of restrictions about who can enter our buildings and under what circumstances. Every patient who's having a procedure is tested for COVID-19 prior, 3 to 5 days prior to the procedure. And then we're testing high-risk members of our workforce routinely also to ensure that we're testing people who are impacting patients very closely. And then finally, we're even doing antibody testing for large components of our workforce. So we're starting to get an appreciation for the prevalence of people who may have been COVID positive who are working on the front lines of healthcare. And thankfully, in our organization, those numbers have been extremely low.
Well, you've dedicated the month of May as Hartford HealthCare Heroes Month. Tell us about that. That sounds awesome.
Well, this month of May, traditionally, we begin May with Nurses Week. It's also Hospital Week. It's EMS Week, recognizing all the people working in emergency medical services. And what we've really said is, has there ever been a better time, Lisa, to recognize everybody, every person who's working on the front line of healthcare, the people working in support services, our food services team, our environmental services team, clinicians like our respiratory therapists, people who do biomedical engineering and keep all of our equipment operationalizing and have been supporting our ventilators and respirators. It was such a wonderful time to spend this month recognizing all people who are helping us during this crisis, but also help us every day always and stand ready in healthcare. So it's been a wonderful celebration. I'm really proud of it. I'm really touched by the outpouring of support from our communities for the people who work in healthcare and who really do such extraordinary work every day.
Agreed. Total and absolute heroes. All right. Hartford HealthCare has made testing widely available across the state. The most accessible it's been, especially in urban areas. Talk about why that's so critical.
Well, I'm so proud. So we have 9 testing centers set up statewide. So we've built a massive testing apparatus. At Hartford HealthCare, we actually created a company that has 127 staff members that we redeployed to exclusively work in these 9 test centers. But importantly, and maybe even most importantly, we've set up a mobile testing center. And we have several now mobile testing centers that we send out every day. They're testing at schools, in churches, community centers, nursing homes, homeless shelters. We're even testing the Department of Corrections officers. So importantly, we're able to target communities, bring it to where people live and work, make it accessible to them. We've created systems to eliminate any barriers to testing. It's being done at no cost to the people we're testing. And it's really important for us to do. So we're getting good data. We know where and how there's different levels of prevalence. And we've removed, any concern that people have around how they can get testing by eliminating any type of wait or even physician orders for that matter. We've created mechanisms for people who don't have physicians to get a clinician order whenever necessary.
Yeah, you guys have made it really easy. All right, Jeffrey Flaks, President and CEO of Hartford HealthCare. As always, thank you for joining us today.